Hi, welcome to my channel, The Registered Nurse. Welcome. My name is Latoya and I'm a registered nurse. And on this channel we're going to talk about nursing. We're going to talk about what it's like being a nurse. I have been a registered nurse since 2008 and I want us to be able to have a voice, have a platform where we can let people know what it's like being a registered nurse, being a nurse on the whole, being a CRNA, being a PCA, being an LPN, a nursing assistant, all these different types of nurses, caseworkers. I want people to understand that we are people too. I want people to understand that we have feelings and we have needs like everyone else. It's like in society, people think that registered nurses make all this money. They look at us and say, oh, she's a nurse. Oh, sure, she makes a lot of money. That is so not true. We are paid less than teachers. We are paid less than definitely doctors. We are paid less than pharmacists. We are paid less than social workers. You can research it and see. So this channel is to talk about what it's like being a nurse. Being a nurse is coming to work. Critical thinking automatically have to kick in as you come to work, because you have to think about everything. You have to think about all the needs of a patient to be met. You are responsible. We are like the moms of the patient of the hospital. We are the ones that have to ensure that physio does their job, to ensure the social worker does their job, to ensure that the pharmacist does their job. All the people that they make pay more than us, we are the ones responsible to ensure that the patient have their full attention and that the patient receives the best. For some reason, people are not taught hospital etiquette. We need to teach hospital etiquette. We will have a series where we'll teach about hospital etiquette, because everyone knows about normal etiquette, being able to eat at a table. But what about having etiquette when you come to the hospital? Have etiquette and know how to treat one another, know how to speak to the nurses, know to understand that when we say sir, this is the policy. It is not me personally against you, but it is the policy of the hospital. So I want us to talk about these things. I want us to talk about what it's like to not be represented properly by unions and associations, and to have respect from our managers, not nursing managers alone. I'm speaking about to the top level, CEOs and chief of staff, and even patients and their relatives. I want us to expose that. I even want to do the plus side, the positive side of it. The positive side of nursing is the experience, what it's like helping someone. How do you feel when you help someone? It's awesome. When you help someone, you feel excited to know that, wow, I was an instrument in helping this person get back better. We actually do enjoy doing that. What we don't enjoy is disrespect. We don't enjoy people belittling our efforts. We don't enjoy our colleagues eating each other. As they always say, nurses eat their young. We need to change that. We need to expose these things. We need to talk about bullying in nursing. We need to talk about what it's like to be, victimized as a registered nurse, as a nurse on a whole, working in the nursing system, being a part of the nursing team. And I would like this channel to be able to give each and every one, each level of nurses, a voice. Then be able to come on here and describe what it's like, to talk about their career, talk about what the journey was like to become a nurse, so that they can tell you what you need if you are thinking about nursing. We want to expose not just the positive, but we want to talk about just the negative, the middle, everything. We want everything on this channel. We want to expose all. So on this channel, we'll be interviewing nurses, we'll be interviewing RNs, LPNs, travel nurses. We're going to interview all the different careers in nursing, all from the PCA come right up to a nurse practitioner. So we want to interview nurses and let people know, let people hear from their voice. Let us give each other a voice, that we can have a community, that we can come together and we can talk and we can chat and we can have fun and we can express how we feel and we can come up with ways to cope. For example, right now we're in a pandemic and nurses are not coping well. We are not coping well at all. We feel as though we have no support. We feel as though people look at us as we are just some replaceable instrument. We feel as though, we are not, people think we are not affected by seeing all our patients die. Let me tell you, we do. Sometimes we cry. Sometimes we are sad. Sometimes we are so hurt. You would think it's our relative. But it's because we are humans too. It's because we have feelings. It's because we know it's not going to be a nice conversation to call a relative and tell them that their relative had passed. It's not nice. And this pandemic is very heavy on us. It is on the backs of the health system. And I can tell you that nurses are bearing the brunt of it. We are understaffed. We are understaffed a million. I don't even know how much we can say this. But we need assistance. We need the society to hear, to support us, to be there for us. Not just the doctors you guys be there for. Because for some reason in the world, everyone respects a doctor. Everyone respects the opinion of a doctor, a medical physician. But for some reason, a nurse, they look over that person. And she has to be there with you for hours. She is there with you, standing with you. She's there with you for a shoulder to cry. She's there with you to fight for you. She's your advocate. She is there for you in every form of fashion that she can, physically and humanly possible. So please, this is a station where a channel that we would expose this, open it up, give us a voice, and express ourselves. So look out every week for a new video. And don't forget to like and subscribe and share this video to all the nurses that you know, so we can all become a community and I can talk with you guys and we can chat and we can just put it out there. Let the world hear us. Let the world feel us. Let them understand us and grow together. So have a nice day. Remember, nurses does it better always.